Hello family, welcome back to my channel. For those that are here for the first time, welcome. My name is Dr. Lentiso and I am a junior doctor working in the UK. The goal of my channel is to encourage people to pursue their dreams, especially those that are in the healthcare profession. I will also be posting educational videos of topics that I think would be beneficial. Plus, I will be vlogging sometimes to show what the day-to-day life of a doctor looks like. So if you're interested in any of this, then this is the channel for you. So like, comment, subscribe, and also click on the bell to be notified when I upload amazing videos like this. All right, let's get started. Today, I'm going to talk about COVID-19, the infamous virus that has impacted all our lives. As you know, second wave is here and a lot of places are going into a lockdown or will be going into one soon if they have not already. And as you can imagine, with the rise in the cases, there's also a huge demand on doctors and healthcare professionals. A lot of elective cases and appointments are being canceled so that doctors can manage COVID positive patients. I have been deployed into a COVID ward the past 2 weeks, and it has been a huge learning curve. It has been very interesting and eye-opening. So I'm going to share with you everything I learned working in a COVID ward. I worked in a non-aerosol generating procedure areas. What aerosol generating procedures are procedures that result in the production of airborne particles or respiratory droplets. For example, these are patients that have been intubated or are being extubated, or patients that are undergoing bronchoscopy, or those that are using high flow nasal oxygen, or those that have CPAP, BiPAP, any of these procedures that result in the production of airborne particles or respiratory droplets are put in an AGP area. And when a healthcare professional walks into those areas, we have to make sure that we wear an FFP2 mask that fits us well, or an N95 mask. In addition to that, we have to make sure that we wear our shields, or if we don't like shields, then we can wear our goggles to make sure that our eyes are covered. Since I worked in a non-AGP area, I just wore surgical mask and same thing, my shield or my goggles to make sure that my eyes are covered, and then I wore my scrubs and then a plastic apron and gloves. I just had to do a lot of washing to make sure that I don't bring any COVID home with me. One of the things that we do upon admission of a COVID positive patient is that we assess the frailty of the patient. And the worse patients are on the frailty scale, the more likely it is that they will experience a severe illness and a higher mortality. There was a large observational study that was done that showed that frailty determined the disease outcome better than age or even comorbidity. So there's a clinical frailty scale that we use, and it would show us whether a patient is very fit, as in this patient works out and is very active, eats well, and is healthy for their age. On the opposite spectrum, that are terminally ill, these are patients that have a low life expectancy, less than 6 months life expectancy, and are evidently frail. So the worse a patient is on the frailty scale, the more likely they will experience a severe illness with COVID-19. And we also assess the comorbidity of the patient. There are some pre-existing conditions that increase the likelihood of having severe illness. The US Center of Disease Control listed a number of pre-existing conditions that increase this risk of having severe illness. And the conditions are chronic kidney disease, COPD, coronary artery disease, heart failure, type 1 and 2 diabetes, asthma, moderate to severe, stroke, hypertension, and dementia. One site that I really like, that I want to introduce you to, is alama.org.uk, COVID-19 Medical Risk Assessment, and this is a site that gives you your COVID age. Basically what it means is it assesses your vulnerability. All you have to do is just go to Google and type in COVID-19 Medical Risk Assessment. Obviously, take this with a pinch of salt because it may not be 100% accurate, but it kind of gives you an idea of what your risk of mortality would be. So I really like this. I want to share it with you. For example, I can show you mine. I'll do mine on here and then show you what it looks like. So basically, it's asking me what my age is. I'm 26, female, black. And you can see that it's changing my COVID age to 28. Because I was black, there's a higher risk of mortality amongst black people. So my COVID age increased by 2, so 28. If infection occurs, the probability that it will be fatal is expected to lie between 0.08 per 1,000 and 0.3%. But if I was male, a black male, then that would be a different story. It would be even higher. I would have a higher risk of fatality. But if I was a female and white, then I would fare well. The patients that are admitted into the hospital are the ones that have severe symptoms. The common symptoms of COVID are usually fever, shortness of breath, loss of sense of taste or smell, cough. It's usually dry, but it can also be a productive cough. And if these symptoms are mild or moderate, then patients are usually told to isolate at home and manage their symptoms at home. But if the symptoms are severe and if patients get hypoxic and if they're having really severe symptoms, they're admitted into the hospital. The most common thing that I've seen amongst all patients is hypoxia. Most patients upon admission have an oxygen saturation of 90 or less, and the target oxygen saturation for all patients is between 94 to 98%, except COPD patients. COPD patient, the target is between 88 to 92%. So what we do is we supplement them with oxygen and make sure that they get to that target oxygen saturation. Furthermore, almost every patient that I have seen are on dexamethasone, which is a corticosteroid, and we give them dexamethasone 6 milligram once daily. And this has been shown to improve their mortality and decrease the likelihood of being put on invasive ventilation. And another common thing about COVID-19 is that for those patients that have severe illness, it increases the formation of blood clots. So most patients are put on venous thromboembolism prophylaxis. So at my hospital, we put most patients on deltaparin, 5,000 units, because that is the prophylactic dose. And another thing that we do is we manage their symptoms. So if they have fever or pain, then we put them on paracetamol or ibuprofen as an antipyretic or as an analgesic. And if they need fluids, we give them fluids. If some patients are showing a bacterial infection, then we can put them on antibiotics such as doxycycline or coamoxiclav. Those are the two antibiotics that I've seen being used at my hospital, but it could be other antibiotics in other hospitals as well, or it depends on what bacterial culture they grow. If all these treatments are not working, usually we escalate them to a more invasive ventilation, or they might even be put on a ventilator. But these are the common things that we do initially upon admission into the hospital, and most patients that I've seen improve with these management and they end up going home better. But there have been a few patients that have been escalated into ITU for more invasive ventilation. That is all I have for today. I hope you liked it and I hope it was educational. If there's any topic that you'd like me to discuss on my next videos, please leave a comment and let me know what those topics are. Until I see you next, I hope you have an amazing time. Don't forget to like, comment, subscribe, and click on the bell to be notified when I upload my next videos. I love you. Bye.